The other group, high volume eaters, is good for restrictive procedure, and the low volume eaters is good for combination procedure. And which combination procedure to select? We are very comfortable with the mini gastric bypass, because why we love mini gastric bypass is that this procedure gives you a big pouch so that you have some luxury to eat. You can eat and lose weight at the same time. This procedure is very good for moderate volume eaters or low volume eaters, because they can eat almost the same amount what they were eating before surgery. Although they won't start eating that much just within 5-7 days, but after say about 2-3 months they'll be back almost to the same volume of diet. And another good thing with the mini gastric bypass which we like is that because of the big pouch and big outlet, these patients can be started with semi-solid diet on the next day of surgery. Whereas in sleeve or in band, where we have made the stomach very tight, we have to ask the patient to be on liquid diet at least for 6 weeks. So this is, I would say this is a big difference if we see it from the patient's point of view, because we don't want you to hold the solids for too long. That would be a crash dieting kind of thing if I ask you to be on liquid diet for 1.5 months. So this is one luxury with MGB. You can be on semi-solid diet from day 2, like dal, dalia, khichdi, and maybe some mashed tomatoes or some soup or something like that. Even you can take some curries on day 2, and on day 7 you can start with the solid diet, although you have to chew well and you won't be able to eat too much in the beginning, but after about 2-3 months you'll be eating a moderate amount of diet. And the other good thing which we feel with the mini gastric bypass is that there is no mechanical obstruction like the sleeve or band, where you have some tightness here. In MGB the outlet is big, so patient is eating easily. So we have happier patients with MGB. So we suggest mini gastric bypass to the low volume eaters. High volume eaters, if they are too big, like they are super Bs, even then we would suggest mini gastric bypass. Another good thing which I feel about mini gastric bypass is that the procedure is tailorable according to the patient. We can alter the dose of the procedure. If your weight is 90 kilos, we would give you a 5 feet bypass. For 150 kilos, we can give 8 feet. Or if you are 200 kilos, we can give 10 feet. It's just a fair guess, but the thing is we can alter the dose of the surgery. Somebody is non-vegetarian, we can give slightly longer length of the bypass. If somebody is pure vegetarian, relatively shorter length. And in the long run, we see that the mini gastric bypass pouch dilates only slightly because the outlet is wide. There is low pressure system in the MGB pouch. Unlike the sleeve, where you have the sphincters on both the sides, there is some nausea, feeling of retching, discomfort in the first 2-3 months after the restrictive procedures. But with the mini gastric bypass, where the outlet is wide, patients are happier because they can eat faster and they can eat a moderate amount of diet without much nausea or vomiting. And in the long run, because the outlet is wide, the pouch of the MGB, what we are seeing in our practice is that it is not dilating too much. Even into the 8th year after surgery, our patients are eating almost the same amount of food which they were taking in the 2nd or 3rd month of surgery. Maybe 2 or 3 chapatis. And this is for most of the patients, but rarely we get dilatation that is 3-4%. Unlike the restrictive procedures which can expand back to any amount. So long-term dilatation less, nausea vomiting is less, you can be back to the solid diet quickly, and the chances of leak are less, after MGB because it's a low pressure system. The food is going down easily. And it's reversible as well, because in some cases, again, you have to see while selecting the bariatric surgery for you whether you want a reversible procedure or not. My version is, for the extreme cases, like if somebody is super obese, 200 kilos, 250 kilos, I might have to give a 10 or 12 feet bypass. But what if you lose too much? If you lose too much of weight, we can get out of it. We can reverse the procedure. But there's an easy exit, just 15 to 20 minutes reversal with the mini gastric bypass. And if somebody is just 90 kilos, again, for these patients, if they think they have lost too much, it can be reversed. Or sometimes I have seen you don't like it. You want to take the same fried food, same prantas back, and see, we don't know about what's happening in the minds of everybody. There are different types of patients, different types of brains. So my idea is that if the surgery can be easily reversed, it is an added advantage, although it's not mandatory, because we have to look into the scientific data as well. Sleeve is a good surgery for the high volume eaters, and for those patients where we do not want much of malabsorption. But MGB or other gastric bypasses, as I have discussed, these are good for the low volume eaters, or especially the young patients where we know that after a certain period of time they are going to dilate the pouch or the sleeve and then they'll be back. So they need relatively durable procedures. So with this, I would finish my talk. If you have any questions, I'm happy to answer that. Thank you very much.